Did you know that bronchitis affects a significant percentage of Americans each year? Yes, it's true. Bronchitis, a condition that inflames the bronchial tubes, the passageways that carry air to and from your lungs, is more common than you might think. Now you may be wondering, what exactly is bronchitis? Well, it's a respiratory disease that causes swelling and inflammation in the bronchial tubes. These tubes are the highways of our respiratory system, transporting air from our nose and mouth to our lungs. But when bronchitis strikes, these vital passageways become irritated and produce excess mucus, making it harder for air to pass through. This results in bouts of coughing, often accompanied by a thick, discolored mucus. It can also cause shortness of breath, wheezing, and chest tightness. So just how many Americans grapple with this condition? Well, it's difficult to pin down the exact number as many cases go unreported. However, estimates suggest that millions of Americans are diagnosed with bronchitis each year. It's a significant health issue that we can't afford to ignore. Bronchitis can affect anyone, regardless of age or overall health status. But certain groups, like the elderly, young children, and those with weakened immune systems or pre-existing respiratory conditions, are particularly susceptible. But here's the good news: bronchitis is often preventable and treatable. With the right knowledge and resources, we can reduce its impact on our communities. Understanding bronchitis begins with knowing its causes, which we will delve into next. Bronchitis isn't a disease that just appears out of nowhere. There are several factors that contribute to its occurrence. Let's delve into some of these causes to better understand this ailment. One of the leading causes of bronchitis is viral infections. These viruses are often the same ones that give us the common cold or the flu. When they infiltrate our respiratory system, they can cause inflammation in the bronchial tubes, resulting in bronchitis. Bacteria can also play a role in causing bronchitis, although this is less common than viral bronchitis. Certain types of bacteria, such as Mycoplasma pneumonia or Bordetella pertussis, can lead to bronchitis. Then we have lifestyle and environmental factors. One of the most significant of these is smoking. Cigarette smoke is extremely harmful to the lungs and bronchial tubes. It damages the cilia, the tiny hair-like structures that keep our airways clean, making it easier for viruses and bacteria to cause infections. This is why smokers are at a higher risk of developing bronchitis. Exposure to certain pollutants can also increase the risk of bronchitis. These include dust, fumes, and chemical irritants, which can all cause inflammation in the bronchial tubes when frequently inhaled. Air pollution is another factor to consider. Those living in areas with poor air quality are more likely to develop bronchitis due to the constant exposure to harmful particles and gases in the air. Lastly, people with weakened immune systems, whether due to age, underlying health conditions, or certain medications, are more susceptible to bronchitis. Their bodies may struggle to fight off the viruses and bacteria that can lead to the condition. Now that we know the causes, it's time to talk about how to combat this disease. While bronchitis can be a daunting health issue, there are various treatments available to tackle it. The treatment plan for bronchitis largely depends on its type and severity, but the primary goal is to help alleviate symptoms, manage discomfort, and prevent complications. First on the list are antibiotics. These are particularly effective when bronchitis is caused by a bacterial infection. By killing the bacteria or stopping their growth, antibiotics can help the body's immune system fight off the infection, leaving you feeling better in no time. Secondly, there are cough suppressants. These can be helpful in controlling persistent coughs that can keep you awake at night or interrupt your daily activities. However, it's important to note that not all coughs should be suppressed. A productive cough, which brings up mucus from the lungs, can actually be beneficial in clearing the infection. Bronchodilators are another form of treatment. These medications are used to relax and open the air passages in the lungs, making breathing easier for those with bronchitis. They're usually administered through an inhaler or nebulizer and are commonly used in cases of chronic bronchitis or asthma. Lastly, lifestyle changes can play a significant role in managing and preventing bronchitis. One of the most impactful changes is to quit smoking. Cigarette smoke damages the airways in the lungs, making them more prone to infections and diseases like bronchitis. If you're a smoker with bronchitis, quitting could be the most effective treatment of all. Other non-medical interventions include staying hydrated to thin out mucus, using a humidifier to moisten your nasal and throat passages, and avoiding exposure to irritants that can further inflame your bronchial tubes. Each of these treatments has its role and effectiveness. Your healthcare provider will guide you in choosing the most appropriate treatment based on your specific symptoms and overall health status. Knowing how to treat bronchitis is crucial, but prevention is always better than cure. So remember to take good care of your respiratory health. After all, your breath is the rhythm of life. Bronchitis, like many diseases, is best dealt with by preventing it from occurring in the first place. Prevention is always better than cure, right? So let's talk about some of the preventive measures you can take to reduce your risk of bronchitis. First, steer clear of smoking. Whether it's secondhand or firsthand, smoke can irritate the lining of your bronchial tubes, increasing your chances of developing bronchitis. If you're a smoker, quitting might seem daunting, but remember, it's a crucial step towards a bronchitis-free life. Next up, we have pollution. Air pollution, which can come from factories, cars, and even dust, can also irritate your bronchial tubes. Now, we can't all move to the countryside to avoid city smog, but we can wear face masks when we're in heavily polluted areas. This simple act can act as a barrier, protecting us from harmful pollutants that could lead to bronchitis. Maintaining good hygiene is another key preventive measure. Regular hand washing, especially during cold and flu season, can help keep viruses at bay. Remember, bronchitis is often caused by the same viruses that cause the common cold or flu, so by avoiding these, you're also reducing your risk of bronchitis. Lastly, it's also important to maintain a healthy lifestyle. Regular exercise, a balanced diet, and adequate sleep can all contribute to a strong immune system, which can fight off infections before they lead to bronchitis. Preventing bronchitis requires awareness and proactive steps, much like staying informed about health topics. So let's continue to educate ourselves, take preventive measures, and strive for better health. After all, our health is our greatest wealth. Knowledge is power, especially when it comes to your health. In the vast landscape of wellness, understanding conditions like bronchitis, their causes, treatments, and preventive measures can be a game changer. It's not just about dealing with the present, but also about preparing for the future. By staying informed, you're not just reacting to health issues as they come, but actively taking control of your health journey. Consider bronchitis. It's a common condition, but it's not something to brush off lightly. Knowing the causes can help you make lifestyle changes to lower your risk. Understanding the treatments can help you make informed decisions if you or a loved one are diagnosed. And knowing the preventive measures can help you avoid this respiratory ailment altogether. Your health matters. It's the foundation upon which you build your life, your dreams, your adventures. So let's keep the conversation going. Let's continue learning together, growing together, and building a healthier future. Like, comment, and subscribe if you like this type of content, and if there's something you want to learn about, leave it in the comment section so I can make the content for you.